Dr. Odoi. I'm the founder and owner for Oasis Women's Functional Medicine Practice, which is a boutique female-only practice located here in Rochester, New York. So today I'm going to talk about labs and what it means, especially in the functional medicine world. So a lot of times you've been told that your lab is normal, you've gone in to see your physician, you have multiple complaints, especially fatigue is the number one thing that I see in my practice. And they do a battery of tests and everything comes back normal. And you are wondering, why do I still feel so exhausted? So the issue is a couple of things. We will start with what normal labs mean. So the way they came up with the ranges to report labs are based on studies or research that they've done on only white men, many years ago, average weight of 70 kilograms. And so those are the numbers that they used in research. A lot of research in the beginning did not include women because of our hormone fluctuations. It will confound results. So a lot of research did not include women for that reason. And so first, the lab reporting is a bit skewed, and it's not, it's the best we have so far, right? But it's skewed still. And so it is quite okay, or it's quite normal to not feel well, but your lab, numbers be within that range. The main goal of the labs is really to detect disease. And so as long as your number does not detect a disease, you are considered fine, right? And so that's the first issue that I want you to be aware of. The second issue is we also look at to think about is when it comes to your labs is that we look at patterns versus like a snapshot number. And so if over the years you've been tracking your TSH, which is like a marker for your thyroid, or you've been tracking your hemoglobin, which is a marker for anemia, or whatever you've been tracking, what numbers on your labs you've been tracking, it matters whether this change in terms of consistency. And so that's also another helpful thing to know when it comes to what, quote unquote, normal labs are. So for instance, if your white blood count is always low and suddenly it goes up, even if it does not go within the disease category, it may be too high for you because you are always low, and it may actually indicate the starting signs of an infection, for instance. And so that's something that you have to pay attention to. So this takes me to the topic of fatigue. So when you come in and you have a concern for fatigue, there are so many things that could be contributing to fatigue. There could be blood work issues like anemia. There could be a thyroid issue. There could be a metabolic issue, such as your insulin not being properly regulated. There could be a sleep issue. So the important thing is to go and see a practitioner who will sit down with you and really talk to you about your history, when the fatigue started, and also compare your old labs to the newer ones they received versus just getting a snapshot of labs and saying, well, everything is normal. So for instance, if your TSH has always been one number and all of a sudden it increases, that's important to know, right? Because now, although it's within the normal range, it may not be normal for you. It may be that your thyroid is beginning to show signs of, either slowing down or working too hard. And so those things all need to be looked into. And this brings me to my fourth point, is a lot of times because you've been struggling with fatigue and you've been told that your labs are normal, a lot of women turn to supplements. They just go online and they find their favorite influencer who is, marketing a particular supplement, and they get it because they are tired and they've been told everything else is normal. So now you are reaching for straws, you are trying different things to see what really will work for you. And so a word of caution about supplements is that without knowing what exactly is wrong, it's not advisable to just take supplements because it's going to help with fatigue. And so the next thing to do is, see a practitioner or see your physician and really discuss your symptoms, right? Your symptoms always is the first and foremost. When it started, how it's going, and what things you've done. And then we look at your labs and also, most importantly, compare what it has been over the years and notice if there has been any slight changes, and really hone in on those things. And if all else fails, it may be that you are going through perimenopause, and I'm going to do more videos to talk about what perimenopause looks like. There are about 49 symptoms of perimenopause, and so if you are feeling different and you're feeling exhausted and you've done all these things that I've talked about, look at your lab work, look at the patterns to make sure it's staying consistent, you've looked at your habits, everything is fairly consistent, then the next thing to look into is perimenopause. And it's really a clinical diagnosis. It is not something that we can do a lab test to diagnose. It is really us sitting down with you and reviewing your symptoms and discussing it, and then saying that, well, based on your age, based on these symptoms, you are in perimenopause. And then we develop a plan to really help you feel better, because at the end of the day, you want to feel better, you want to feel like yourself again, you want to be able to play, you want to be able to do presentations without pausing and thinking. You want to be able to go to a room and remember exactly why you went there. And so if this sounds like you, I have my link below. Go ahead and book a wellness consult, and we can discuss your symptoms and come up with a plan that's actually targeted and personalized for you. Thank you.